Hey everyone, my name is Sienna Boyd. We are in the Truth Health studio. This time we are with Dr. Rahman, who is one of our physicians at our Makena location. And today we are just going to get to know her, all about her and her medicine. So, Dr. Rahman, tell us first and foremost, what made you fall in love with medicine enough to become a doctor?
Yeah, well, the reason that I went into medicine is because, of course, I love to help people, and my grandmother was a midwife, and when I was young, I would always go around, wherever she went, and I saw the joy that she had, like when delivering, all these babies, and so that was my first interest, and then growing up, that was just my nature, just to go into medicine and help people.
Cool. I love that. And so you just knew after watching your grandma that you wanted to be a part of medicine.
Absolutely.
So where did you go to school to learn how to be a doctor?
Yeah. So for undergrad, I went to UC Riverside, where
nice.
I got my bachelor's.
Okay.
And then for medical school, I went to a Caribbean medical school where I got my MD and as well as my master's in biomedical sciences.
Wow.
And after that, I came back to the U.S. and I did my residency at the county hospital in Riverside, where I became the chief resident there.
Nice.
And shortly after graduating, I became faculty at Loma Linda, where I taught residents and medical students. And then shortly after that, my program hired me back on to become an attending there, where I was teaching again residents at that residency program in addition to Loma Linda students.
Wow, so you both worked at a hospital in Riverside as well as at Loma Linda, so you have a lot of hospital experience.
That is correct.
What then brought you out to Temecula to do family practice?
So the reason that I moved to Temecula is for family reasons.
Mm-hmm.
I'm closer to my parents who live in San Diego.
Oh, yeah.
And in addition to that, the reason that I'm here is because Dr. M met me at one of our meetings, and he said, the Rancho was a fabulous place to work. So
Yes,
I came here and I kind of stayed here, and they were talking about the residency programs, and that's my passion too, is to teach residents and to do clinic, and I'm also a hospitalist. So initially when I came with Rancho, I was mainly doing hospital work, and now I'm still continuing to do hospital work, but mainly supervising our physician assistants in the hospital, in addition to doing residency work and outpatient care.
So what I'm hearing is you not only see people in clinic, you also are training new residents in the hospital, and you are also rounding on patients in the hospital.
That is correct.
So tell us about the hospitalist aspect of your job, because I know that's a more recent buzzword in the medical community. Growing up, I didn't hear of what a hospitalist was. So can you explain that for us?
Yeah. So a hospitalist is a physician that takes care of acutely ill patients in the hospital setting, where these patients are really sick. They can't be home. They have to be taken care of in the hospital so we can get them in the right place in terms of their chronic diseases. And once they're stable, we discharge them with a really good plan for them to follow up with their outpatient primary care physician, where hopefully they'll continue to control their chronic diseases so they don't end up back in the hospital.
Definitely. Okay, very interesting. So outside of the medical realm of your life, what do you love to do for fun outside of the clinic and outside of teaching?
So outside the clinic, you'll find me by the water somewhere, by the beach.
Is that why you went to the Caribbean for med school?
That's one of the reasons.
Yes.
That's one of the reasons. So usually the beach, spending time with family. So those.
Do you have kids? Do you have family around here?
I do. I have 3 boys. 2 of them are still living with me.
Nice.
The other one is engaged and about to get married, hopefully.
Yay. How exciting. That's awesome. So lots of family around you. Do they like to go to the beach with you around the water?
Absolutely. Yeah, I've trained them well.
Train them well, yes.
Train
Love
them
the
well.
beach.
Yeah, so they really enjoy the beach as well.
That's awesome.
Yeah.
I wanted to know also about your philosophy of care. I know I've asked a lot of different doctors that, and everybody has a different approach to medicine. So can you tell us what your personal medicine philosophy is?
So my philosophy is to treat every patient with a lot of compassion and kindness, because every patient has a story. And a lot of the patients that I see, it's really sad. The reason that they choose to come to Rancho, one of the main reasons, is because they hear how compassionate and kind we are as physicians, because we listen to them. And I've had patients just tear up and say, I can't believe you're listening to all my problems. Usually physicians will tell me to stop here, can't go anymore. And so just that is who we are, and that is who I am, and that's why I think we have a lot of patients that stay with us. It's because of the type of care that we give, in addition to being compassionate and kind, and you know, we provide the best care and the best quality of care around.
Definitely. That's awesome. I love that.
Yeah.
I know I've been a patient at Rancho my whole life, so many years of my life, and I can attest to that as well. So it's really awesome to be a part of this group and see that on the backside, and see really how much our doctors truly care for our patients.
Absolutely.
Well, thank you so much, Dr. Rahman, for being with us and telling us about you. We're so excited just to get to know you more today.
Thank you.
If you're interested in seeing Dr. Rahman in clinic, or if you're looking for a new primary care provider, Dr. Rahman is accepting new patients at our Makena location, which is right off of Temecula Parkway. So if you're interested, you can always give us a call. Other than that, again, thank you so much for having us.
Thank you.